bloggers and social media writers should at least desist from making bad remarks against our officers in the hospital.
My name is Dan Murugu. I'm a Nakuru resident of the last 50 years. I would wish to address the Nakuru on yesterday transfer of the medical superintendent at Nakuru level 5 hospital. These changes at the management of this facility were communicated by the current chief officer for medical services, Dr. Murima. Following this development, I have the following to say. One, we are concerned that this action by the said CEO, Chief Officer Mr. Murima, has actually caught us by surprise, taking into consideration that, and also in view of the Governor Manifesto, there was actually a need to consult all Nakuru residents and also health stakeholders maybe before this decision was to be taken. I hold the common view that we, in the last couple of months, we have raised some genuine concern about the mismanagement of this hospital, and most of which actually were addressed to the last administration. And I believe the current the administration under Governor Susan Keka was actually believed on the same. Now we are actually not. It's not very clear what actually the grounds that maybe the county government of Nakuru arrived at this decision, and now we find that the officer who has been transferred by the name Dr. Aisha Maina has been transferred to Bahati Hospital to serve in the capacity of a dentist. We have had a concern that the position and the titling of the senior position in this hospital of Medi Super, we wanted this position that be changed to Chief Executive Officer, where now this position would actually be an officer to serve in this capacity would actually be completely recruited via a media advert in the local newspapers. That now the medics who are actually interested to serve in this capacity would apply. Then there would be a shortlisting and also interview, then to arrive to the most suitable person to serve in this capacity. Now the changes are reflect that Dr. James Owero, who was serving as the deputy to Dr. Aisha Maina, has taken over. So we find that this is actually not going to help this mega health facility in terms of administration, management, use of public funds, issues about human resource, and also maybe working with partners. So we would want that maybe the transfers, the government will rethink these kind of changes until maybe we give ourselves maybe 2 weeks. We are able to consult and actually get a better way forward of the same, and a win-win situation. Here with me I have a list of this is actually Kenya Gazette of 2018. It captures the name of the people who serve as board members in all our hospitals in Nakuru. We are not comfortable with how these appointments have been effected previously, and under the administration of Governor Susan Keka, we wanted to see an improvement in terms of actually the people who would actually serve in this capacity, their integrity, and also these are supposed to be people of good morals. So the transfers, if they have to take place, then it actually has to take place in all the medical facilities in Nakuru, and I think we have about 50. And then when you change the medical superintendents, then the same also should apply to the board members, who at least for the current who are serving at this capacity, their time is over. And as I had said, would want people of integrity appointed to serve in this capacity. So I would wish that to appeal to the county government to review the changes which were actually effected yesterday. Maybe we have a serious consultation, because we, as I've suggested, we wanted a change of the title of the medical superintendent to become the chief executive officer, and the position also to be competitively recruited in terms of people applying, and also getting the best person to serve in this capacity. And similarly, also we also want that board members are appointed also in a very transparent manner. We also want a mechanism to do an oversight in terms of maybe the money which actually is allocated to this hospital as conditional grants, and any other that maybe we could have partners actually injecting to be able to improve services. Finally, concern against the Nakuru County Assembly Health Committee. I think this committee has actually slept on the job, and so far since actually they were elected, I don't think they've been able to visit our health facility. Now, out of these, we find that most of actually our facilities are actually under poor management, and service delivery is actually a matter of great concern. Another critical issue of our concern is that over the last 3 years, the person who's been serving this capacity is coming from the dental profession. So we do want that any person appointed to serve in this capacity, this appointment to be done rotational. So this time we had a dentist serving this capacity. Now we think the right person who would actually take over this position should actually come from the public health field. Taking into consideration that previously we had several gynecologists having served in the same. So we are proposing that in future that all the medical professionals should actually have a chance to serve in this capacity, where now the top boss in this hospital is actually a chief executive officer. So already the dentists have actually had their time. So this Owero person, I think I gather he's also a gynecologist, and from 2010 all the senior officers who are serving this capacity were gynecologists. So the county government of Nakuru should actually take immediate action to do serious overhaul on the management of this hospital if actually decide to actually offer better services for our people. Thank you very much.
My name is Alelias Magoma, the chairman of Nakuru Residents Association. Actually, my concern is about the transfers that were effected yesterday by the CEO Health, Dr. Murima. Anyway, we are not against the transfers, but basically we are basing our issues on PGH, which is a very paramount facility in our lives in Nakuru. By appointing one, Dr. James Waweru, to that facility, it seems that at least you could have kept one Dr. Aisha, because we were complaining of the total overhaul of the management of PGH as a facility. Not just appointing somebody who had been working there. At least they could have looked for somebody from outside who has an experience, who is not tainted like Dr. James Waweru, who is not tainted like James Waweru to run that facility. We have seen in several cases that the hospital and the management, those two people, has totally gone down. Now, what we could have requested is that the transfers of these senior-most people, senior-most professionals at PGH, at least be reviewed. Again, there were transfers of these junior officers. Recently, we had this biometrical assessment from the Department of Human Resources. We don't know the numbers. The biometrical report has not even come out to know exactly who is a host worker. So by transferring those people to various areas, that means they want to defeat justice. At least those people should be brought back, and the transfers should not be affected by now. Let it be stay that way till we know exactly what took place. The real workers at the facilities in the Department of Health, at least so that we may know who is who in which section he serves. Again, the medical superintendent who is going to be both at PGH or other facilities in the Department of Health should be at least purely professional health services. Again, the boards should be disbanded. They should go with their medical superintendents. That's a very major issue that we have with these board directors of the various health facilities in the county.
My name is Laban Omsundi. I'm a resident of this town, an activist. And the changes that we have seen in medical, actually we support it. This is something that we have been yearning for, and actually we needed a big change in the PGH simply because of what is happening there. It's not actually, it's actually unbecoming. And the service delivery is actually extremely wanting, and it's actually very poor. And we have made a lot of noise in social medias looking for that changes. And we appreciate for the administration of the Nakuru County government to make those appropriate changes. And we believe with the new leadership in place, it will bring the necessary changes in terms of having positive service delivery to the patients who will be seeking services from PGH.
Another issue of serious concern that residents have started to note out is that these people, the officers, the senior officers of the county, are working closely with the bloggers and these other medias, social media actors. Social media and bloggers are not able to transfer an officer. We have come to note that at least these people are just blowing around here that they transferred Aisha Minor, they want to transfer more if they are not going to be fed with at least a few things. Now, we have noticed that these bloggers and social media writers, most of them are contractors at PGH. We are condemning this act of barbarism. We are condemning this act of just writing on social media, writing some things, bad things about our facilities so that they can be called and be given something. We are not going to understand that. Only we want that a competent person who has worked very well should not bow down to bloggers and social media, because they are now boasting around that they have boasted. I want to transfer you. If you don't see me, I want to transfer you. I want to transfer. No, we have to understand under whose mandate do these people work for. If I thought they can write something small in a page, then they work on it. Then they want to scare our officers. That's very bad, in fact. So those things, bloggers and social media writers should at least desist from making bad remarks against our officers in the hospital for it to run.